another day with the physicians where your health is our business.
With growth spot will end. So you are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know is
You're welcome back to the training culture of your regular program. By maintaining a good relationship with your dental team, you can improve your understanding of how to effectively care for your mouth, not only for your oral health, but your wider health too. Some of the people that make these things happen, the dental team, include the dentist, the dental therapist, the dental hygienist, the dental nurse, of course the dental technician. On today's episode on your regular program, The Physicians, we'll be talking about the gum health and the dental team. We'll be back after this short break. It's another day with the physicians where your health is our business. Today we'll be talking about gum health. Your gum, my gum, our gum. What do you have to know about it? What is it that is important about the gum that we need to take a special day and discuss it as an episode? Well, my name is Dr. Martina Agbemi, your regular host on this program. I'm not alone. As usual, I have my celebrity shink with me, Dr.
Memuna Yusuf Kadri. Is always nice to be here with you every week.
We're talking about gum health.
Yes.
Is it possible to smile and not expose the gum?
Yes, it's possible. Some people don't when they smile.
I think that is what you call the fake smile. Somebody who is smiling and you're not seeing the gum, it most likely to be the fake smile, right?
Depends on your interpretation. But truly there's fake and there's the real smile. And most time when people smile deeply, you will have a glimpse of what the gum looks like.
Have you ever seen a black gum before?
Yeah, I have. I've seen a black gum. And I wasn't freaked out because the contrast between the black gum and the teeth were just too glary, like very bright, white, sparkling teeth. So
bright, sparkling.
Yeah.
So are you trying to insinuate that even when you brush your teeth, you also brush the gum?
A lot of times we don't brush the gum because they are quite sensitive. Yeah, but when we kind of rinse and then we have the toothpaste in our mouth, we tend to use that to kind of do the cleaning. Because if you brush your gum, you're going to bleed, because gum do bleed, especially if you have the gum, some of the gum
know
diseases.
If the gum is actually like a muscle too, like a covering, because when you have an extraction, you see, or you look at the skeleton, you see that the teeth is actually
inside the gum. Yeah.
So what is that gum? What is that? What is the function of the gum?
Yes, why is it there? Why is it important?
Why is it important? Yeah. Does it have to do with beauty too? Do you think the way the gum is set?
Yes, because that's what our 32 teeth. It's like it has to be arranged and it needs a base. So obviously that is a base. Without it, I don't know how we'll be looking. Like our teeth will be sticking.
Anyway, next week we'll have expert that will be telling us more about the gum and the diseases that actually associated with gum, your oral hygiene. We'll be back after this short break. Just stay tuned. to your regular program, The Physicians, where your health is our business. So today we'll be talking about gum health. Yes, you heard me right, gum health. How have you been taking care of your gum? Is it part of your dental hygiene each time you take the toothbrush in the morning? Is it part of what you consciously take care of? Well, in our studio today, we have a guest. He is a dental enthusiast. He cares a lot about the preventive medicine that has to do with oral health. His name is Dr. Fasasi. And of course, he is not alone. We also have a dental therapist, Mrs. Olasimbo Owoade. And welcome to The Physicians.
Thank you very much.
Nice having you on this program.
Welcome. Nice having you both.
I'm very, very excited because in the past we've always talked about dental health, dental caries, toothache, and all those things. Now we want to talk about attention being paid to the gum, the gum health. So tell me about it. What is gum health?
Gum health is basically when the gum is free from any form of disease whatsoever. The features of a healthy gum include that's the gum being coral pink, not red. Then it's a gum that doesn't bleed on gentle probing or slight touch. Then it's also a gum that is devoid of any infections, is free from any form of infection, is free from any form of abscess collection, is free from any form of pus discharge. Then there's also a gum that is firm and not loose. That's firm to the firmly attached to the tooth or the underlying structures or tissues. Then it is also a gum that is not swollen. So it is coral pink in color, just the usual color, although it could be pigmented in some people. Then it is devoid of any form of swelling, there's no bleeding, there's no pain, there's no form of discomfort, there's no unpleasant taste, or there's no form of mouth odor or halitosis. So that's just basically a broad overview of what a healthy gum should look like.
So, when we now talk about an unhealthy gum, what are the possible causes?
Causes of unhealthy gum. Yeah. I'll say the main cause, the primary cause of an unhealthy gum is the plaque that is in the bacteria that is bacteria left over in your plaque or calculus that is adhering to your teeth, causing infection.
Wow.
That is the primary cause. However, there are some other risk factors that can predispose ones to having gum infection. For example, for people that have crowded teeth or overlapping teeth, people that have crowded teeth tend to have areas where plaque and calculus will deposit and really grow very well. And it is always difficult for your toothbrush to get them out.
Okay.
So by the time those plaque and calculus deposit, they irritate the gum, thereby leading to gum disease. The gum will be reddish, it will be bleeding, and you could even be giving out bad smell. But overlapping teeth, also, we can have ill-fitting dental processes. People that uses denture, if the denture is not fitting well, underneath it could be housing bacteria, could be housing food debris. We, at the end of the day, will irritate the gum. The gum will start looking reddish, will start looking inflamed, and the person will start feeling pain. Also, people that have malnutrition, if you are not feeding right, if you are just malnutrition, if you're not feeding right, the person's immune system will be low. So the person will not be able to fight off any infection that may want to arise. Also, poor diet. I would like to emphasize on poor diet, because a lot of people are fond of just eating food that are high in sugar or carbohydrates, which increases the level of sugar in the mouth and thereby increasing the level of bacteria in the mouth. And if you're not rehydrating, taking lots of water, when you take water rehydrates the body and also cleanses your mouth, washes away the plaque that are maybe just forming. You can just get dislodged with water if you're not taking enough water, and also if you're not taking enough vitamins. All those ones can predispose one to having gum disease.
So now let's know about this. How do you know that you have a challenge with the gum? The symptoms of an unhealthy gum.
The symptoms or the signs are basically redness, changing color. We know how you know how the color of your gum usually is. So if it starts to change to become, if it starts to become more reddish, or it becomes inflamed, swollen, then if it also loses its attachment, if it's not firm, if it's no longer firm, then this is some form of infection, ulceration, wounds, or sores. Just to explain it better, if there's some form of sores or pain related to the gum, then the person can say he has some form of gum disease and he needs to seek.
Why is the gum actually important to the human being?
Yes.
Why is it important?
The gum is very, very important to the human being, in the sense that, first, the mouth generally is important. I'll also talk about the gum. The mouth generally is important in the sense that it's like the gateway to the body. When you eat, it's through your mouth. When you talk, it's through your mouth. So a lot of attention should be placed on our mouth, on our gum, and the health of the oral cavity, or our oral health generally. A lot of attention should be placed and should be put on the health of the oral cavity, our mouth, our teeth, and gums. And why is it important? Because the gum is a component of the periodontium. Now, that may be a big term, but periodontium is just the supporting structures of the teeth.
Good. That's what I want. Yeah.
Yes, that's just basically what the gum is. So it helps support the teeth and ensure it is rightly in place. It helps to make it withstand occlusal forces of mastication when we are eating.
Okay.
So it helps, it has some protective components also.
What are the common diseases when it comes to gum? Now we're not talking about the whole mouth, just the gum. What are the kind of common diseases affiliated or associated with the gum?
A very common one is gingivitis, basically inflammation of the gum or swelling of the gum. And the primary cause is poor oral hygiene, associated with accumulation of plaque, which irritates the gum and induces inflammation. So that's one of the common examples of gum disease. Another is periodontitis. Now, periodontitis is when it now, since I said earlier that periodontium is like a supporting structures of the teeth. So when the inflammation has now affected the whole supporting structures, we can call that periodontitis. If it has now affected the whole supporting structure of the teeth. So that's another example. Those are the two major examples. Other examples are gingival enlargement. Then there could be infections, which could be from bacterial, viral, or fungal origin. Then there could be neoplasms or cancers, which could also affect and cause ulcerations.
But are there other systemic diseases that can be linked? Maybe people that have existing hypertension, diabetes, other maybe cancer that can affect the gum.
Yes.
Like co-traveler that they are together, or as a result of this existing disease, that is why the person is having a gum disease.
Yes. There's what we call oral manifestations of systemic disease. Yes. So a very common example is diabetes, uncontrolled uncontrolled diabetes, when the patient has an increased level of blood sugar and is not seeking medical attention, is not taking medication to control it. So if it's uncontrolled, there are manifestations. It could actually cause periodontitis on the long run.
Wow. Dr. Fasasi, just hold it there. So let's hear from the physicians out there, keeping on with the physicians what they have to say about gum health. We'll be back after this short break.
No. I've never been to the dental clinic before.
Yes, I have.
No, I've never been to a dental clinic before.
Yes, to remove my teeth. I've been there once.
I don't really know.
I don't know.
I have no idea because I've not visited any dental clinic. So,
to my own idea, I think 3 months.
I think up, down. I do mine up, down, up, down. That's how I brush.
no man, now up, down, up, down.
You know, you can do it this way. Anyhow, you just want to use the brush, then brush up and clean all the teeth.
At least 2 times daily, morning, night. At night before you go to bed.
At least twice, in the morning and at night before going to bed.
I brush 2 times a day, in the morning and then probably before I go to bed.
3 times daily. And I do that 3 times. I do it in the morning, like 7 a.m. In the afternoon, maybe 2 p.m. And in the night, 8 o'clock.
Chewing stick, charcoal. Then some use this powdered formula. While some use, I think I've heard someone said baking powder is also used for the teeth, for whitening the teeth.
Mouthwash, chewing stick, charcoal, powder, etc. Many things.
Toothbrush, toothpaste. The olden days, I've not seen that. They say they use charcoal. I've not experienced that before. The chewing stick, of which my father most of the times always do that.
Charcoal or eggshells or salt. Which one you prefer? In case maybe there's no toothpaste or anything you can use to brush, you can use charcoal, eggshells, or maybe broken plates.
Yeah, welcome back to your regular program, The Physicians, where your health is our business. I'm sure you had fun hearing what your colleagues or your people out there talked about the gum health. As a doctor, you just talked about the oral manifestation of some of the gum diseases.
Yes,
and you did talk about diabetes.
Yes,
and people that have diabetes, uncontrolled diabetic patients,
yes,
can come down with some diseases, okay?
yes,
So is there any more you want us to talk about? How about hypertensive patients? How about children? Is there anything that has to do with children in this also?
Well, children with viral infections.
Viral
Okay.
infection.
Patients who have some form of immunosuppression.
Okay.
For example, HIV patients, full-blown AIDS patients who have some form of immunosuppression. This reduces the immunity of the individual and of course predisposed to any form of infection or disease, gum disease inclusive.
Okay.
So that's actually one example. Then it's also very important that I would mention the fact that patients who are taking drugs to treat cancers, like chemotherapies, could actually cause some form of gum disease or some form of gum enlargement and ulcerations and diseases generally. Then it's also very important I mention the fact that even some drugs, antihypertensive drugs, like you mentioned, patients with hypertension, they take, for them to control their hypertension, they have to take antihypertensives, and some of these antihypertensives have been implicated in as one of the causes of gum disease, like causing gum enlargement. Even patients on anticonvulsant drugs too. But one of the major causes is plaque deposition, plaque accumulation, and poor hygiene. So it's very important for us to do a proper oral hygiene care for the patient. So she will discuss more on that.
So how do you handle that? Yeah,
exactly. Okay. The oral hygiene care, that's where this model will come in.
Yeah. Okay.
When we want to, as we said,
we give you the model that you want to use it?
I'll take it.
With the toothbrush.
Okay, thank you, doctor. Thanks. Okay, when we're talking about oral hygiene, by the time we look, the plaque buildup and all that, we want to do what we know that generally known as scaling and polishing. That is
S&P.
S&P.
Yeah.
That is the removal of plaque, deposit stains, and all that. But at times, if the plaque deposits have really gone down to the root, we will have to do deep root scaling or root planing. You have to go underneath the gum to clean out. Because sometimes these bacteria have migrated down to affect the supporting teeth, the supporting structure of the teeth. And we can even have tooth mobility or tooth loss. So we have to clean down. And when we are doing that deep scaling, we employ the use of some mouth rinses, like chlorhexidine mouth rinse. That one will deposit it gently into the pocket to kill the bacteria in the pocket and also aid in healing the pocket so that the pocket can at least close up a bit to so we won't have much space for food debris and plaque to be gathered. So after scaling and polishing, After scaling and polishing, we now give the patient oral hygiene instruction, which is very important, so that the patient can maintain the cleanliness of the teeth. We teach the patient proper toothbrushing technique. A lot of us brush our teeth and then we do it anyhow, the way we were taught in those days. Some people just do, they say we should do up and down, and then they will cleanse their teeth and be doing like this. Doing this, you are pushing this gum further down. You are pushing this gum further up. You know, there's a place here called the cementum. It's a sensitive part, and that's why some people come and they say they have sensitive teeth. They have exposed that place where the gum is supposed to be covering. They have used the toothbrush to brush it and to expose it. So when you're brushing your teeth, it's very important that you open your mouth slightly and then you place your brush. Talking about the toothbrush, our toothbrush, the ideal toothbrush should be a medium textured toothbrush, not hard toothbrush.
People go out to look for the hard one. That is what
I want the hard one. I don't want medium one. I'm like, no, you don't need the hard one. It's the medium one you need.
Because the hard one, they feel that the harder the brush, the better it cleanses. It's wrong. Because the hard brush, it gives your teeth micro laceration, micro cracks. It will be lacerating your teeth gradually. You will not know.
So those are for who? Which group of people take the hard one?
I would just say, smoker's toothbrush is for the people that have stains.
Okay, in the teeth.
Okay. And as soon as your teeth is fine, maybe you have gone for scaling and polishing and all that, just maintain with your medium toothbrush, medium texture toothbrush. Because at the long run, that hard toothbrush will still cause one damage or the other. Yeah. Because we can't be 100% certain of the way you are moving your hand. So when you're brushing, you place your toothbrush at an angle of like 45 on the gum. So as you're brushing, you are massaging your gum. That's why you don't use hard brush. If you're using hard brush, the hard brush will just lacerate your gum and your gum will start bleeding. You place your toothbrush on the gum like this and then you sweep downwards and outwards like this. It depends on the length of your brush head. Some can cover like 2-3 teeth at the same time, sometimes more. So you just move it down gently, about 2-3 strokes until you move down. You keep on going until you move down to the other side. Then the inside too, our mouth still being open, although not this wide. And then you go outwards and downwards this way.
Okay, outward and downwards.
Yes. Okay. By the time you get to the anterior teeth, you take each tooth at a time. And then you brush it outward like this, not this way. Some people will do this, say they should brush one by one, and then they'll be doing this way. Outwards, one by one, starting from this canine to this other one until you get to the other canine. And then we continue with our
the molars.
Yes, to the molars. The occlusal surface, that's the chewing surfaces, you notice that they have pits and fissures in there where there are some food there tend to stick, like foods like plantain, they tend to stick on that. So that's where you brush with the brush head. With your brush head so that you can dislodge whatever particle is there, and then you brush it outwards like this in one direction, not this way, because if you are doing this way you can even cause some more damage outwards this way. And then the lower jaw, the same way we are brushing this one downwards and outwards, the lower jaw we do it upwards and outwards like this way until you move round. The inside too, I will lift my tongue and then we'll brush this way. The anterior teeth one at a time, just like we did the other one and this one, the occlusal surface. And then we brush our tongue. Very important to brush your tongue so that to avoid bad breath, because the tongue is muscular and it houses a lot of bacteria. If you don't clean it very well, it could give up bad breath. You can use your toothbrush to clean your tongue. If you don't have tongue scraper, you can use your toothbrush. And there's some toothbrush that has a mini tongue scraper at the back of it like this. You can do that as well. When you finish brushing your teeth, you can do a self-check by moving your tongue around. It should feel smooth. If it's not smooth, that means there's still plaque somewhere. And then you go back and do that part. And then you rinse your mouth and you're good to go.
Thank you very, very much. It's been an awesome ride.
It's wonderful.
The physicians, yes.
Thank
I'm
you
sure
very much,
we have benefited here, and I'm sure our viewers out there have also benefited.
Thank you.
Thank you so much, Dr. Fasasi, and
much,
thank you, Mrs. Olasimbo Owoade. It's actually a pleasure having you on our program. I'm sure we'll call again. You will actually respond, and we are an enthusiast. I'm sure we will come back again when we call on you. Well, I'm sure you have all heard it from our guests here how to take care of your gum. Gum health is very, very important. The mouth is the gateway to the body, so you have to actually take very good care of your health. It's very important, even for children. You can actually also do that massage. You can use cotton wool and there's a little salt water and massage the gum for babies when they are coming up. You don't have to use any stronger toothbrush for them. You have heard it too. No need to use strong toothbrush. The medium toothbrush is very, very, very important and adequate. You also saw the method of brushing. Outward, the system that is used, not just open your mouth slightly and you brush down so that you can take out the debris. And of course, as usual, we always tell you the best and bring you the best people that can give you very important information on your regular program, The Physician. And Dr. Mimuna,
Thank you very much, Dr. Fasasi.
Thank you, ma'am.
Thank you, Mr. This was a very, very enlightening. Of course, and to our viewers out there, it's always a pleasure bringing you the very best on this show, teaching you what you need to do and how you need to do it. And so please always keep a date with us on The Physicians on your regular channel every Saturday, 7:30 p.m. My name remains Dr. Memina Kadri, and please follow us on all our various social media platforms. And if you want to be a part of this program, we are just a click away. So till next time, stay blessed.
I remain Dr. Martina Agbere. See you again next week. My name is Dr. Isiawe. I'm an endocrinologist and the medical director for Rainbow Specialist Medical Center, Lekki. You're watching The Physicians. Make sure you stay tuned, follow them on YouTube and all the social media handles.
Now we know that epilepsy is a physical illness of the brain, and it is due to abnormal excessive discharge of electrical activity